Yes. Perhaps I should stop at just this one slide, but thank you very much for inviting me to speak this evening. Thanks to the organisers. This is a great pleasure. I feel in some ways I've joined a new family, and I'm very pleased to be welcomed into the Wash family. And I suppose just to pick up what Laurie was saying about 25 years, I've also been working on 25 years around issues of reducing maternal and newborn mortality in low and middle income countries, working collaboratively. Working in environments where, for example, this district hospital, a picture taken in West Africa, and once you're alerted to this sort of sign, the hard reality of the frequency of deaths on the maternity ward and on the paediatric wards means the mortuary and maternity and paediatrics are often close together. This is the hard reality. The main focus of my work has increasingly been around quality of care, particularly around issues of infection. And it's quite interesting how, again, rather like Laurie's saying, rather late in the day, I've come to make or think about the link with water and sanitation. And I think there is an issue about why do some of these issues that we work on for a very long while, we don't make those connections. And obviously this meeting is trying to make those sorts of connections. But some of us do have, if not blind spots, the way that we work or the fields that we're in mean that we don't necessarily look across. And so I have a similar admission. And so after many years of looking at issues around infection and quality of care, I've come to this sort of a sense of outrage in the 21st century that we still do not have clean, safe birth. It's not rocket science, but that's the topic I want to talk about, clean, safe birth. And it's estimated about 60 million women each year deliver in institutions, and more of those 60 million deliver in institutions. We're past the tipping point. More than 50% of women across the world deliver in healthcare institutions, from very large hospitals to much smaller scale units. What I want to do in this short presentation is talk what about behind the doors, and in particular around the water and sanitation, the physical environment in which women are seeking care and the type of care they are receiving. And I've chosen this because I think there is one of these blind spots. I think there is a blind spot around quality of care and the physical environment, particularly in the water and sanitation piece. And I think equally when we talk about WASH, I think it's fair to say a lot of that is focused on the community rather than healthcare facilities. So we probably have some assumptions about healthcare facilities that perhaps I'm going to challenge. I think it's important because, of course, maternity services are a very gendered issue for reasons, not just because it affects women, but there are power dynamics, the sort of thing that Helen mentioned, that are very critical, and women are particularly vulnerable at the time of delivery. But I actually think, more importantly, there's an opportunity to make a difference. So some of that difference today in the 21st century is about making connections. So I think it's a real opportunity. Of course, women's health is much more than childbearing, or much more than reproductive health, but some of the issues about quality of care and the safety of the environment in which women seek care apply whether you're going for family planning or whether you're going for chronic care for a chronic disease. It's the same thing. Maybe some of the issues around childbirth are most acute. And because I'm talking perhaps to a slightly different family, although I recognise some members here, I'm going to try an experiment. I'm rather out of my familiar territory of graphs and PowerPoint slides. I am going to use slides, but I'm going to just use images. And it's what I call image evidence. And myself and a colleague who's here, we're starting work around a new initiative called the Soapbox Collaborative, which relies very heavily, or is building issues up around image evidence. So there's lots of powerful images in this area of pregnancy and childbirth, and here is one of them. There's about 134 million births a year. Thankfully, many of them are wanted, and many of them, thankfully, end up with happy, healthy mothers and indeed babies. But of course, behind the positive image, there's some other underlying negative issues. We still have about 1/3 women each year dying of maternal causes, and we still have 3 million newborn deaths and 2.6 million stillbirths. So behind what can be a very positive event, there is still an issue of adverse outcomes, including mortality. But one of the issues is about the preventability, and there are figures that we use in this field that talks about 88 to 98% of the deaths are preventable. In other words, we know what to do. This is not an area where we don't know what to do in terms of preventing death for mother or newborn. And the birth period is a particularly critical time, obviously, for the baby and for the mother. So I guess the question is about place of birth turns out to be very important. It's important in terms of where you deliver and the type of care that you receive. It's really critical to survival and also the issue of the positive experience for mothers. So what is a safe and respectful place to deliver? Well, of course, there are many elements of the place where you deliver. When we talk about the physical environment, the sort of picture we see here, there's issues of who attends you when you go into a facility and the behaviours of those individuals, the skills that they have, but also the behaviours they practice. And there's a hint at wash in this picture because you can see one of the key things needed for good, safe care is water. And you see here, the water supply is important for all sorts of reasons, not the least is hand washing. And many of you who focus on hand washing in the community probably assume that hand washing in facilities happens routinely. Unfortunately, it doesn't. And some of it is because of lack of water, although sometimes there are these sorts of solutions when there's not piped water, practical solutions, but also because of behaviour. The sort of behaviour that we know hands don't get washed at home. So there's a similarity between what happens in the facility and out of the facility. And of course, hygiene and issues around of water are very important for infection prevention and control. And IPC, infection prevention and control, is really key in high volume facilities, whether it's in the paediatric area or in the maternity area. Places that have a lot of patients and a lot of turnover have particular issues of infection prevention and control. Do we know about this? I sort of shiver if I say such a thing sitting in John Snow Lecture Theatre, because we've known about these sorts of issues for many, many years, in fact, over 200 years. So here is a picture taken in the Glasgow Royal Maternity Hospital. I'll give you a very little bit of history. In about the 1900s, when there was a 4 times higher risk of dying in the facility than out in the community, and in the facility were mostly richer women. And it's the only time in history when richer women died with greater frequency than poor women. It's the only time. Why? Well, because we had very high levels of infection. The quality of care was partly because we didn't understand the situation. We didn't understand about epidemic puerperal fever, and mortality was very high. And then from 1935 to 1950, there was an 80% decline in maternal mortality, 80% in 15 years. And if you look at the pattern, a lot of that, the first trigger of the decline was the reduction of sepsis. Women dying of infection was the first thing that changed dramatically. And of course it changed for all sorts of reasons. But quality of care was the umbrella under which many of the changes went ahead. The environment was changed. The care providers changed so that midwives became very much the centre of attention. And of course there were antibiotics and very scary hairdos. Of course there were antibiotics, so there was, once you had an infection, a treatment paradigm that could deal with the problem. But actually the reality was it was very much around understanding and practising, certainly in terms of the infection control, the importance of poor hygiene. So ending up with what we think today, women-centred care. Women-centred care with the midwife as the lead provider. And some people in the UK would think we've gone backwards in some of our issues around the UK. So one of the things I want us to move on to is to look at to what extent, what is the situation we think about, have any of these practices now been applied in a lower middle income country? And there are all sorts of definitions of clean and safe, the WHO definition which uses 6 cleans, clean care, clean surface to live on, a sort of sociological view that talks about respectful care, and a sort of definition that, for example, the London School has been developing, which looks at the availability of water and sanitation in facilities. So what I want to do in my last 5 minutes is to give you an image storm. Would you wish your relative or your sister or your friend to live here? Or here? And the microbiology of this bed proves that this was a highly unclean environment in which to deliver. One of the problems, of course, is water. It's intermittent, so it's not accessible. It's certainly not available for drinking, but it's also not available for other things to do with keeping the environment clean. Issues of instruments and sterilisation are affected by the availability or not of water. And crucially, it also affects cleaning, a much neglected area. Cleaning, I can't believe after 25 years of looking at obstetric issues, I'm focusing on cleaning. But cleaning is really where there is a major issue. We haven't looked at who cleans, how they're trained, and what they do. The environments in which cleaners undertake their role in high-volume facilities has been completely neglected. And of course, there's also issues of counterfeit bleach, as we see here, so the dilution of the cleaning materials way beyond their effectiveness. And this is what happens. This is a sink on a labour ward that both the nurses have to use, the midwives have to use, but also women if they want to wash their hands. So this is the reality of poor cleaning. So I think one of the issues is, and the toilets, of course, as well, and I apologise, these are images I've taken so I can give permission for them to be used. I understand the circumstances. This is a very poor, I obviously need to link with the photographer. This is the toilet in one maternity unit. This is where you have to go if you're in labour, and it's also where the providers go to use the toilet. But I guess the question is, it doesn't need to be like this. It can be like this. And I think that's the thing that really strikes me as we go between different areas, is that you can see 200 metres apart or in the same town a facility providing good, respectful, clean care with the same resource base as some which is providing disrespectful care. And I think that's the issue that we've got to get at. Why is it? It's not just an issue of lack of resources. It is an issue that is very deep, and I think we're not really understanding well enough. So it can be the sort of environment like this, with good equipment, access to equipment. The sort of, it's not particularly high tech, but it does have equipment that could deal with complications. There are solutions for water, shortage of water supply. There's no doubt about it. It is possible to have a tank like this. And also where there is difficulties and need for greater infection prevention and control, access to gloves, of course. And sinks can indeed look like this. They don't have to look. I mean, these pictures taken in very similar types of environments. Why is it that some are good and some not so good? And the toilets. I mean, these aren't the same toilet cubicle, actually, I have to say. It's the way I've configured the photographs. But it just goes to show, in environments, it is possible to provide a level of sanitation, okay? Some of us would still say this is not as clean as we would wish it to be. But otherwise, there are opportunities for change. And this is not all about resources. So I think in terms of change, I think one of the things I would like to see is I would like to see some of the WASH communities that work so well out in the community linking up with issues around in the facilities. There's a great body of experience of communities being very effective. Can we work with those communities, those committees, the WASH committees like here? We need to think about taking women with us, of course. Women understanding about the importance of cleanliness and feeling they have an entitlement to good, clean delivery. And of course there's the providers as well. It's not as if providers wish to work in disgusting environments. Many that are trained in good asepsis then suddenly find they're working in very poor quality environments, and there is plenty of evidence to suggest if you put someone in a poor environment, their practice, their standards will go down. Do we ever learn? Do we ever learn? So I would like to see more connections, the sort of thing, if you look at, I don't know if you can see in my, I'm not a photographer as you can, as gathered, but if you can see from this picture taken in Bangladesh, groups are working together. We have Waterhaid here and Oxfam. We need some more joined up thinking around addressing the issues within healthcare facilities as well. Institutional delivery is on the increase, and so the question is we need to be prepared. High volume facilities, like for example this one, are not the sort of environments that we should be incentivising or indeed expecting women to go into. We need to prepare ourselves. It's not that we should be discouraging women from going, but we have to get our house in order. Our house in order, and clearly water and sanitation is one very key area. This type of situation should simply not exist. I mean, outrage, whatever word you want to use. This is not the sort of place that should exist in the 21st century. It makes a huge difference at all levels in terms of health outcomes, but also disrespectfulness for the provider as well as for women. So another picture, these pictures that I take that show mortality next to the maternity, mortuary next to the maternity ward, they exist in so many places. And this one has the mop in the background. This is a major referral hospital where the standard of infrastructure is extremely poor. And at the top of the picture, it talks about people getting loans to pay for the care. So there are powerful images when you start looking at healthcare infrastructure. I think WASH has been neglected in healthcare facilities, and I think the quality of care teams have rather overlooked or rather forgotten the importance of the physical environment and ensuring it's improved. I think there's a lot of opportunity for direct collaboration between the groups who are already effective in the community around WASH, but of course there is an evidence base still to be built. We still lack some types of data, but particularly we need an evidence base around behaviour change. Why is it and how is it that some places and some individuals rise above the situation of poor resources and provide good, clean care? What is it about that behaviour change element? So as I said at the beginning, I mean, I'm in a different world, well, a slightly different world, as it were, in terms of linking up and creating with others a new charity called the Soapbox Collaborative. We have a very small stand outside. And what this is wanting to do is to address this issue of off-the-radar screen around clean birth, particularly clean birth, of course, clean birth and facilities, and to raise awareness of this is something that we can do about. Those sorts of pictures I've shown you should not exist in the 21st century. So I very much look forward to making more connections around this theme in the rest of this evening's event. Thank you.